Hello and welcome. This video introduces materials that can support district and school staff as they implement the Handle with Care program. The creation of this video and the materials we describe were funded by the U.S. Department of Education Institute of Education Sciences as part of a partnership between the Regional Educational Laboratory Appalachia and education leaders across Kentucky, Tennessee, Virginia, and West Virginia. In this video, we'll introduce you to one of the founders of the Handle with Care program, present materials that support the implementation of Handle with Care, and let you hear from people in the field who have used the materials and can tell you about how and why they find them valuable. The intended audience for this video includes educators and leaders in schools and districts who have implemented the Handle with Care program and are looking to strengthen their implementation and use data to monitor student outcomes. The audience for this video could also be educators and leaders in schools and districts who are considering implementing Handle with Care and want to learn more about the program, its benefits, and the materials available to support implementation. Let's dive in. Before we get any further, we want to let you know what the Handle with Care program is and what its goals are. Let's hear from Andrea Dar, one of the founders of Handle with Care and director of the West Virginia Center for Children's Justice.
Hello, I'm Andrea, and I'm going to tell you more about the Handle with Care program. We'll start with the problem that schools and districts across the country are facing. Children don't come to school as blank canvases ready to be filled with knowledge. They carry their home lives and out-of-school experiences with them into the classroom every day. If they've experienced trauma, they bring that trauma to school with them too. Students experiencing trauma may engage in behavior that hinders their or their classmates' learning, or behavior that educators don't understand, or they may disengage from classroom and school activities altogether. These students are at risk of poor academic performance, dropping out of school, and delinquency. Now let's talk about the solution. Schools can be a place of safety where students' intellectual, social, and physical needs are met, as long as educators know what to look for and how to create safe, caring spaces for their students. Handle with Care is a program aligned to that solution. What is Handle with Care? Developed in 2013, Handle with Care is a program that brings together schools and first responder agencies to identify students who may have been exposed to trauma. The goal of the program are to, 1, ensure that children who have been exposed to crime, violence, and abuse receive appropriate intervention so they can succeed in school, and 2, interrupt the cycle of trauma, which can undermine children's ability to learn, form relationships, and function appropriately in the classroom. So how does the program work? With the Handle with Care intervention, when a child is at the scene of an incident involving a first responder, such as the fire department, emergency management services, or law enforcement, an individual from the first responder agency on scene asks the child their name and where they go to school. The first responder reports the information to dispatch, who then shares the child's name and the words "Handle with Care" with the district or school contact. The school contact then passes the information along to the appropriate staff within the school, including the student's teacher and school counselors. The first responder does not reveal any information about the incident so as to protect the child's privacy. The school staff are equipped with information that allows them to handle the student with care. Why might the program be important for your school? Handle with Care brings together local agencies that serve as the safety net for children who may be experiencing trauma at home or in their community, and gets these agencies to work together to support these children. Handle with Care also gives educators insight into what happens once their students leave school. Though they might not know that incident led to the students being identified for Handle with Care support, they know that something happened. This can lead to greater empathy and patience for students they teach, and to all school staff applying trauma-informed strategies that support all students every day. When we know more, we can do better. Let's handle each other with care.
Thank you, Andrea, for sharing about the Handle with Care program. As educators strive to support students experiencing trauma, They may find they want a systematic way to monitor Handle with Care implementation and relevant student outcomes. With the support of partners across our 4-state region, REL Appalachia, Andrea Dar, and the West Virginia Center for Children's Justice, and a team of stakeholders in West Virginia created a portfolio of materials that educators can use to track program implementation and student outcomes. The materials we've created with the West Virginia Center for Children's Justice to support Handle with Care implementation include 2 Excel workbooks, a guide that explains how to monitor implementation and student outcomes and how to use the Excel workbooks, and 2 protocols educators can use to support meaningful, data-driven decision-making. These materials help school teams implement the program and make informed decisions about how to improve during the school year. These new materials are meant to make it easier for school teams to monitor Handle with Care implementation and student outcome data. Handle with Care school teams can use data to inform program improvements with the ultimate goal of improving student experience and outcomes. Schools participating in the Handle with Care program may form a Handle with Care school team to regularly review program implementation and student outcome data. This can be an existing team, such as a school improvement team, or it can be a new team created specifically to support and implement Handle with Care. The Handle with Care school team should consist of 4 to 8 people in diverse school roles, such as teachers, administrators, school counselors, and school nurses. Each member of the Handle with Care school team takes on a different role and responsibility, and the Handle with Care materials provide more detail on each of these roles. School teams should select or assign roles to members so that each member can appropriately gather data and prepare for meetings. The program materials include 2 Excel workbooks to support data monitoring and continuous improvement. The Data Lead Workbook and Counselor Workbook help educators collect, analyze, and store data about implementation and student outcomes throughout the school year. Using these workbooks, team members can look at student outcome data across different groups of students who have been identified for Handle with Care support, and all students in the school. Equipped with this knowledge, teams and school leaders can make informed decisions about how to improve support for students to lead to better outcomes. Using data to support program improvement, a guide for monitoring Handle with Care in schools, or the guide, is a comprehensive document that includes instructions for users on how to implement the program using a continuous improvement approach to data-driven decision-making, as well as instructions for how to use the Handle with Care Excel workbooks and discussion protocols. In easy to understand language, this document explains all the features of the Handle with Care Excel workbooks and instructs users how to use data to inform program improvement and targeted supports for students. The guide contains 2 protocols aimed at facilitating discussion. Let's look at the data review meeting discussion guide first. This protocol contains a set of questions to help guide Handle with Care school team meeting discussions. It is designed to help teams make data-informed decisions about program implementation and student supports. The other protocol, the discussion guide for teachers, contains a series of questions that helps the Handle with Care school team gather information from teachers about their experiences supporting students identified for Handle with Care support. Both protocols support meaningful team discussion during data review meetings. Handle with Care school teams are encouraged to follow an iterative cycle that facilitates data-driven decision-making. The 5-step process takes school leaders and staff through a series of steps that ensure they have the proper training and documentation in place to implement the program. First, they conduct program training and prepare necessary documentation. Next, they form a Handle with Care school team with clear roles for members and set a meeting schedule. After that, they help educators support students identified for the program, and then they regularly monitor implementation and student outcome data and adapt implementation to improve throughout the school year. Handle with Care school teams cycle back through the process multiple times throughout the school year to continuously improve the program. Now we've learned about the Handle with Care program and the materials available to support implementation. Next, we'll hear from 2 people who have used these materials in their schools, both of whom served as data leads on their Handle with Care school teams. Let's hear from Amanda Moat, Director of Social Services, Attendance, and Child Nutrition for Pleasants County Schools, and Janet Alio, School Nurse at Mary C. Snow Elementary School in Kanawha County schools. Thank you both for joining us. We're looking forward to hearing your advice to district and school leaders and educators everywhere who are considering using the materials. What should they know about how using the materials will impact their implementation of Handle with Care?
I'm Mandy, and I am so glad to have a chance to tell you about my experience with the Handle with Care program's supporting materials. First, I'd say they're easy to use. They actually save you time. The new materials helped us streamline the things that we were already doing related to tracking student progress.
I'm Janet, and I agree with Mandy. Using the materials is simply a matter of organizing data we already collect and filling in the blanks in the Excel workbooks. It's easy. Further, I'd say the materials help us do our jobs better.
Right. The data helps us understand whether or not what we are doing is effective.
Yes, integrating data on behavior, academics, and attendance helps us get an overall picture of the current state of our school, including any potential deficits or challenges. Then the data can point us towards ways to make improvements.
Regularly reviewing and discussing data with other educators in your school is a great opportunity to brainstorm program improvements and talk about how to better support our students.
The data and materials give teachers an opportunity to have more insight into what is going on with our students. It's been really valuable for our teachers to learn more about what behaviors to look for in students potentially experiencing trauma and what strategies they can use to support those students.
We've used what we've learned from monitoring Handle with Care data for our other efforts too, such as our 504 process for supporting students with disabilities and for our Tier 2 and Tier 3 supports.
In this way, I would say the materials help you work smarter, not harder.
That is the perfect way to describe it. I have to say, the data really makes the difference. I think the data serves as a catalyst. What we glean from the Excel workbooks is valuable because it's boots on the ground, real-time information. The data can reflect students' mental well-being and academic progress. The data even helps families. If the student has academic, attendance, or behavior issues, for example, we can call a meeting and discuss wraparound services, which can really make a difference for the students and their families.
The data also gives school teams a much-needed historical perspective. You can see dips in attendance, for example, and know you need to address attendance right away. I would encourage anyone considering using the materials to do so without any hesitation. You'll be glad you did.
Thank you both so much for sharing your perspectives on the value of using the materials that REL Appalachia co-developed with our partners in West Virginia. We touched on several important topics today: what the Handle with Care program is, what materials are available to you to support implementation, and how those resources can support you and other educators as you undertake Handle with Care in your school. Together, the program and the materials provide powerful tools for you to use to support students who may be experiencing trauma. You'll use a process for data-driven decision-making that you can apply to other work too. For more information about the Handle with Care program, you can review the website listed on the screen or reach out to Andrea Dar. And please visit our REL Appalachia website to learn more about other projects that support the use of data and evidence to improve academic outcomes for students. Thank you.